I'm going to show you our favorite taping for plantar fasciitis, called the low dye taping. And I think this is a little variation that I think works the best of any kind of taping. Now, you have to do it with bare hands. You can't do it with gloves because tape sticks to your glove. We make sure the skin is cleaned with a little alcohol and dry. Our tape works best with the pre-tape, where this is a little pre-tape we're going to use just to make the tape stick a little better. Hopefully not tickle the person too much. So we do that, and that makes it stick a little better. Now what we're going to do, we're going to start with a 1-inch tape, and we're going to go around the foot making a U. So I'm going to start at the big toe. I'm going to make a U all the way around the foot. So we start around here like this. So this is going to be a U. And that's what we're going to tape to. This is going to be our base there.
Show the 1-inch tape.
So there's the 1-inch tape. This is 1-inch, just regular cloth adhesive tape. The only tape I don't like is the waterproof tape. Now we're going to start making 2 or 3 circles on the bottom here, like half figure of 8s. We're going on the bottom like that. We're going to do 2 or 3 of those, and I'm going to do another one right over that, right next to it. And this is the third. I'll do the third one right next to that. So there's our 3 on the bottom. And that acts like, almost like a plantar fascia that augments the normal plantar fascia. Now this is the second part, and this is one of the most important parts. We're going to take a 2-inch tape. This is 2-inch tape. Again, cloth tape, same kind of tape. And we're going to go from the outside of the foot, pulling up into the arch. Now when I do this, I'm trying not to get any folds in the tape. We're going to overlap it about 30% or so. So we're always pulling the arch up. Always up into the arch. Up into the arch, up into the arch. We're pulling the arch up. If we really want more support, we go even higher on the one side. But you can see I'm going from the outside of the foot to the inside, overlapping 30 or 40%. Okay? I'm going to make sure all those are tight. We try to avoid getting any folds in there because that can compromise, pinch the skin and make it painful. Now for heel pain, I try to enclose the heel. One of the adaptations we've made for this is just to go around the heel, squeeze the heel, and try to compress the heel a little bit. There we go. And again, however many you need to do to hold the heel in, we want to do that. We want to enclose the heel so there's no open area for the heel. Okay, so we're going to cut that, and we can trim this up a little bit on this side. So basically we've enclosed the heel. Now we're all done except for one thing. We're going to put a final sealing tape over this. Usually what I do is I do a 2-inch or a 1-inch, either one. I try to cut it in a kind of a little semicircle so it's not so straight. Then we're going to go around. This doesn't matter how we do this. We're just going to go over those ends. And that's really it. People ask if they need to use kinesio tape or a stretch tape. I prefer a non-stretch tape, and we don't have a problem with that because we're not going around a body part. We don't have to worry about cutting off circulation. Circulation can get in through here. We want pretty strong support. It's not really necessary that it'll look real pretty. You can also tear the tape. It is a little nicer to cut it. We do those 3 on the bottom, the ones up in the arch, and the final one to seal it off. Now one other thing I sometimes do when I do it in the office, it's not necessary to do this at home, we take a tape called Coban. This is a stretch tape, a non-adherent tape, and we put it over the ends of the other. Now we are going around a body part. Now we're using a stretch tape, and that just holds down the ends till they can glue down to the skin. It is not necessary to do this, and if this rolls up, you just take it off. Usually I'll leave this on for a few hours. We roll the sock on over it. We don't step down on it until the taping is on. So we put the shoe on, sock, shoe on, and then step down on it. We usually leave it on about 2 days, sometimes as long as 4. It's much better if it stays dry. And we can never predict how long it's going to stay on somebody. Some people will stay on an hour if you keep it dry. Some people will stay on a week even if they get it wet. So it just depends on how your skin takes the tape. And if you get any irritation or if it bothers you, pull it off and it's gone. Thanks for watching.